Right now we are going to a very sensitive topic called postpartum depression. Chef Abdalla alikuwa anauliza hiyo nini?
I'm wondering, you can't even pronounce it properly.
Mazi, and just a pointer about this condition. It usually affects women, especially those who are pregnant women. Take a look at what we prepared.
A very good morning to you. Welcome to Leading Up. This is Health and Wellness Monday, and today we visit Dr. Maureen Owiti at the Gynecare. And today we're talking about what happens to a mother when they have a baby, the depression that comes afterward. It's not for all, but some take it for granted and they do not know how to handle it and what it is. But today we have Dr. Maureen Owiti to tell us all about that. Thank you so much for having us today.
You're very welcome, Mikwali, and it's a pleasure having you here.
All right. So we're going to start with the basics. You know, for the way we're brought up, a child is supposed to be a blessing. It's supposed to be a celebration, a Thanksgiving kind of thing. So when you tell your mom that you're having post-baby blues, you're not happy, you're sad, they would not get it. My mom would not get it. So how do we even tell them? Let's start from what is postpartum depression?
Okay, that's a fantastic question, Mikali. So I think just by the meaning of the word postpartum are those big, nice words we like to use, but just means, partum means to deliver. Okay, so post means anything that happens after the delivery, and depression, I think most of us will be familiar with the word, is just that feeling that you're either very sad or something is wrong, you're depressed basically. So that's in short what postpartum depression is. Now, just to give us an idea, we have various shades of the postpartum depression. So you've talked about blues. I heard you mention blues, yeah? Whereby blues would be the mildest form, and that will actually occur in about 85% of our women. 85% of the people having various forms of psychiatric instability following delivery. About 85% of the women will get the blues. But it's something that's just transient, and it goes away 2-3 weeks. You may back to normal. However, it can develop and become the depression proper, and the worst case scenario, you can actually get psychosis. So that will be the most serious. So you find the depression will be in about 10 to 15% of those women who have delivered, and the psychosis will be in about 0.5 to 1%.
What did you say causes this? Because as a mother, I would not want to get to a point where now I'm looking at the baby and feeling why am I sad? I should be happy. So what are some of the things that causes the women to go through this kind of depression?
Okay. Mikali, I don't know if you have children of your own.
No, I don't. Hopefully very soon.
Hopefully very soon.
Yeah.
But it's again something that you must understand that especially like for first time mothers, I feel they again would be more at risk. It's just something new, you have new responsibilities, and it just becomes really overwhelming for the woman to handle. And other things that would cope, you'll find you'd like to find out, is it something that maybe we could have stopped from before when she was pregnant? Is something? And you find that actually a lot of people do actually have problems prior to the delivery, probably just has not been diagnosed, and after delivery, because of the severe change in her hormones, she, and I think would relate it to something like the premenstrual syndrome. It's a change, the hormone change. You find it's just too much for her, and she'll either get the blues, depression, and as I've said, worst case scenario, the psychosis. And we hope we don't go into psychosis, because that's not.
That's something that happens when you're especially a first time mom. You get tensed. That's what I see. Confused. The baby cries. You end up crying with them because you don't know what they're saying, what they need. So it might turn out to be anxiety. Now, how do you tell when it stops being anxiety and becomes now proper depression?
Okay, fine. In terms of depression, with you, as I've said, with the blues is something, they'll be a bit teary, very sensitive to anything you've said. But usually with the blues, as I've said, within 1 or 2 weeks, the woman, and if she has a good coping mechanism, and I think that there's no better coping mechanism than a supportive family around you. If she has a good coping mechanism, most people will be able to get through that session and cope. But now you find it's persisting and she's not improving, then at that point, it could be that she's developing depression. So again, you've asked, how do we diagnose this? So you find we've talked about crying a lot.
Yes.
We've talked about feeling sad, feeling worthless. They just don't have anywhere to go. They can't do anything right. They don't know what's happening. And just that desperation, it's just not going away. And it can get to the point where they actually have homicidal, whereby they want to kill somebody, but just ideas. They don't do it practically, or even suicidal they get. So by the time somebody feels they're getting suicidal thoughts or thoughts of wanting to harm somebody else or do something, definitely that person is in some form of depression. And then you have the worst case in the psychosis cases where they actually can either go one or two ways. They withdraw into themselves completely, don't talk to anybody, numb, or worse, can even become manic and have bizarre behavior.
So it actually gets to a point where the baby is in harm's way.
Yes.
Can the mom be separated at this point from the baby?
Depending on how serious, and as I said, it's a bit challenging even for us as health workers, because you must realize we don't visit the mothers every day. We rely on them to come for their visits, and even the time when you have the amount of exposure time you have with them, you probably have 15, at very best 30 minutes max, and it may not be enough time to really diagnose the problem unless relatives who come with the mother and are concerned and now voice this. So even for us as clinicians, it's a very challenging thing to diagnose. You usually will get diagnosed the serious forms, because obviously by the time I've not talked to my husband for 5 days and I'm a very jolly, laughing, talkative person, of course, definitely at that time the people will come and voice their concern. But unless, I mean, they look just like you, just like me, like everybody else. So it really takes somebody who knows that person to see that there's a change in their behavior and stuff. So as I've said, at that time, your support is very important. And I think you know what's happening in Nairobi right now. We have a lot of single mothers, and that we don't really have that big social support as we used to have in the past. When you're married, you stay with your husband alone. So unless somebody really comes out, or the woman herself feels there's something wrong and voices that concern, but she may think it's normal, that's part of the pregnancy.
When you're having conversations with the single moms, most of them will tell you, I wasn't ready for this, I wasn't in love with a guy, or I wasn't ready to get married, or I just chose to become a single mom. And thinking about the things that will put someone through postpartum depression, is it because they did not want the baby? Is it because they were not ready? What is it exactly? Or is it a mix of everything?
It'll be a mix of everything, and definitely, as you said, those now would be triggers. Definitely going through a pregnancy you're not ready for, psychological, and even psychological is just one aspect. There's a financial aspect that goes through pregnancy itself. It's not cheap, even with free maternity, but it's not necessarily a very cheap thing. And again, delivery and taking care, responsibility of a child that you're not really ready for, that could definitely be a trigger. But again, what are the backgrounds that we have that would tip somebody over into something like that? So any form of stress, whether it be financial, whether it be a relationship, so even so it's not necessarily something that I would say is unique to single mothers. You may find a single mother may actually be less at risk because she has no stress of
a spouse.
The spouse. There could be tension within the marital home, but we thank God that not all marriages have strife. But if you find that the relationship is strained at that particular time and there's no support, and as I've said, the hormonal changes they go through, you can't even understand what's wrong with you. You feel there's something wrong, but yourself you don't understand what exactly is happening. So it's just any stress factor, and if we're not able to address that stress factor, they deliver. They now have an additional stress of looking after a new baby, the changes that are happening to your body. You're puffed up, swollen, you're tired, all that. So it just tips you over. And in the best case scenario, as I said, you can go through the blues. Worst case, you get the psychosis.
How do you go about treating the postpartum depression?
Okay, fortunately, we're in the era of multidisciplinary help. So usually we'd ask the assistance of our psychiatric colleagues, and we'd also get the help of counselors. We'll also get the help of counselors, and it's really to get to the bottom of what is the main stress factor that is triggering the situation. Once you're able to at least address what the situation is, try to call in other family members and to give the woman the support that she requires. And you find if she has blues and you're able to do that, you would actually be able to treat the woman without necessarily giving her any medication. But if you're not able to do, and again, as I said, that is somebody with blues, somebody with outright depression, we'd obviously need a psychiatrist to also help us diagnose that this is actually depression. So if they diagnose there's depression, we have categories of drugs from antidepressants to mood stabilizers and things like that. So that's what we'd be able to give the women. And in extreme cases, up to this electroconvulsive therapy.
Wow.
Yes.
That's quite extreme.
Yes.
So antidepressants, so I'm supposed to take these pills. I'm a mother, I'm breastfeeding. Is that okay for a mother to take antidepressants while they're breastfeeding?
Most of those drugs are actually secreted in breast milk, so definitely it is a concern. However, most studies have shown that the few studies that have been done, they're not quite a number, it's limited. So in terms of the information you have is not that much, but the little information that we do have is that fortunately very little of some of the drugs is actually found in the baby. However, as you said, most of these drugs, you're going to take them for a long time. You don't take them for 1 day or 1 week like an antibiotic and stop. So we really don't know what is the long-term effect of taking it. But you look at it where the benefit outweighs the risk, obviously. We're going to take them. There are some drugs that have been used for a long time and are relatively safe. So definitely we'll stick to the drugs that have not shown any particular harm to the baby. So, but you have specific drugs like valproic acid, whereby you find it's hepatotoxic to the baby. So definitely we'd have to avoid such a drug for the baby.
Huge word you just thrown in there.
It's just one of that, yes. Then things like lithium definitely is not advised. So definitely with our colleagues, it's tough whereby we'll take into cognizance that the mother is breastfeeding and we'll tailor her medications to that are relatively, and please note the use of the word relatively safe for the mother, but definitely for us, her health is important. If we're not able to stabilize her, it can get to a very psychiatric emergency.
Okay. Yeah. So I was looking through a few research done, research is done concerning the postpartum depression, and the one thing that comes out is sometimes the mums have difficulty breastfeeding.
Yes.
They feel like it's a big issue. They don't want to do it. What is the relationship between those two?
Okay. Again, I think we've discussed earlier one of the issues that could be leading to the depression. So we've talked about something like an unwanted pregnancy. We also have interesting cases whereby, say, a woman had wanted a son or a daughter, gets opposite sex. So, and again, as I said, the hormonal changes makes her behave not the way she would actually normally behave and reason. So you find, or at that time, she's having severe strife with the husband and stuff like that. So whatever reason, is she getting back at the husband? It's his child. She's not going to feed his child. You know, it sounds ridiculous, but those are the things that are probably going through their mind. But I didn't want this child. Why should I breastfeed this child? And you must realize they're not in a position to really make a rational decision. So it's not that if you stabilize them, they'll realize there's nothing wrong and the baby needs some milk and it's the baby, and they'll go along. And as I've said, at least with the blues, most of them get out of it, and if we're able to give them good support, they'll actually finally enjoy motherhood. So yes, it's a big deal, but it's again really understanding that the reason they're having is that there was some big stress, there's some hormonal change, and all of a sudden what seems rational to you is not rational to that particular person.
Absolutely.
Yeah.
Now, a mother has come to you to talk about whatever is happening to them, and you understand or realize that she's got postpartum depression. How do you then encourage or tell her to do? What are the things that she's supposed to do to cope with this, to ensure that the baby is safe, the baby is healthy, and she, as a mother as well, does not get to the stage of being the stage of psychosis?
Okay. Again, in psychiatry, it's one of those things whereby it's really a detailed consultation with the mother and really to determine. Yeah. So if you come out and she doesn't have any particular ill feeling towards the baby, I mean, you'll get that from your consultation, and you'll try to explore. And in most cases, I believe our psychiatric colleagues are able to come up with a conclusion on that. And if you feel she's not at risk, definitely she can stay with the mother.
Okay.
But if you find definitely she's having obvious thoughts, she wants to kill the baby, she wants to kill herself, obviously she's at risk. Such patients, you'd obviously have to immediately admit them and try to give them medication or treatment that will stabilize them immediately.
Okay.
Other than that, unfortunately, it's just a clinical judgment. I really can't say that we're going to be 100% correct in all cases, but I think we're reasonably correct in a majority of cases.
Absolutely.
Yeah.
Now, they say if you went to reach out to anyone, use the woman, because the woman will be connected to the husband, to the baby, to the village, basically. How about the man that lives with a woman? How can he help the woman deal with postpartum depression?
It's actually fantastic that you've mentioned about the man, and even there's a new entity also that we want to consider, whereby do men get postpartum depression?
I was gonna get there,
And,
but yeah.
So, and you find actually that in such a situation, even the man is actually stressed, and actually is at risk of going into depression himself because of the situation he finds himself in. But definitely the idea is really to try to explore what is the main stress factor that is triggering this depression. If you're able to come up with that, then it would be how to come up with strategies on how to address that. Yeah, but in the meantime, if obviously they're in severe depression or having psychosis, definitely we'll have to probably admit and treat both. Usually we admit the woman because that's the person we have, but if the man also has symptoms and we explore and turns out he has depression, I mean, why not? He can also be admitted. Definitely not in the maternity, but...
All right.
Yeah.
Totally got that. Now, at what do we have like time limits for, if you have the baby blues, if it's gotten past 2 months, that's when, there's a problem? Do we have the time limits for that?
Okay, I think I've mentioned it previously, that with postpartum blues, within a week, 2 weeks, the mother should be stable.
That's it?
Yeah, that's it. So beyond that, if it's persisting beyond that, is when we'll probably diagnose depression or psychosis. Yeah.
Wow. I would have thought probably baby blues should go on for like 3 months, maybe perhaps. No? And what
that as I said, it's really like just like drawing strings, but it's like where does one start and where does one stop? So there's kind of like an overlap whereby it can initially start, it's blues, she goes for an assessment, she's figured out to be blues, but she doesn't pull out in a reasonable amount of time. Then at that point you can now say probably this was not blues, this is depression. But as I've said, it's really, really trying to find out what are the triggers and what's causing that. I think also we didn't mention, but there are other very important stress factors. We're in the era of, we have people like Nakada. So you find drugs and substance abuse, you find are also quite linked, and these people also tend to be at higher risk of getting the depression. Yes.
Okay.
Especially if you consider, like, if you're a drug user or an alcoholic, and you're pregnant, and the withdrawal symptoms and all that. So those are also, again, very important factors, and also should be explored as part of the history we're taking when we meet these people.
Okay. Yeah. Looking at the family setup, we've talked about the mother, we've talked about the husband. What about this kid who's being brought up in a family that probably the mom, who has direct contact to the baby, suffered postpartum depression? Is there are they affected in a way as they grow up?
Okay. That's an awesome question, because we have to tackle it from point of view of meds, and I think we touched on the issue of meds that really don't know, but there could be some long-term effects because of the medication that we give the mother. But in terms of long-term effects, would be if the mother obviously did not get proper assessment and proper management at that time. It will mean that she's going to continue and have a depressive disorder. And you can imagine a child growing up with a mother who is in depression. Obviously, it's somebody who's not going to be stable, because they're going to, again, be going through either the mother may not necessarily be able to adequately look after the psychological needs of that child. Yeah,
true. Dr. I'd like you to just take a minute and encourage, because I'm sure the pregnant women will be watching the show and be thinking, am I at risk? What are some of the things that I should do now that should protect me? Maybe we should just look into that camera and encourage them and tell them probably the things they need to do to protect themselves from getting PPD.
Okay. In terms of postpartum depression, the main thing is to have a good support network, and a good support network can be in form of friends, can be in form of family, and for most of us, as I said, 85%, it's something that will be transient, and with a good support network, you should be able to pull out of it. So it's not all grim. I think what we have talked about are the severe cases, which are not that many. And even for those who get the severe cases, that is the psychosis or depression, if they're able to come to a healthcare provider and get assistance early, it's something that can be treated, and they should be able to get out of.
All right. Thank you so much. We need to bring this conversation to an end. But one final question. Can postpartum depression just go down or get finished by just itself?
Okay. As we said, for us, we have used postpartum depression as the broad topic.
Yes.
And I think I've been very clear that for the blues, generally should clear on their own. But if it's outright depression or psychosis, definitely that cannot resolve on its own. We need medical assistance.
Well, there you have it. If you've got postpartum depression, that means you went through the baby blues for 2 weeks and is still continuing to feel sad, a bit teary, a bit depressed, then that means you need to look and seek medical attention. I've been speaking to Dr. Maureen Owiti, and we've had a very, very intensive conversation concerning this condition. I hope you've learned so much. Remember to contact us on our social media platforms as KTN Life and Style on Facebook, KTN Life _Style on Twitter and Instagram. SMS is 22840. Our WhatsApp number is 0700 574747. This has been Leaving Up. We're taking a very short commercial break. When we come back, we're going to have Brian on Beyond the Sports.
My message would be they have to be themselves. They have to believe in what they do every single day. Nobody will come outside and talk to them and say, look, you are the best player in the world, whatever. They have to come within themselves.